Welcome to part 2 on our review of our course. So here we're talking a little bit about what's in the course, and I just want to talk about the modern student. I mean, heck, all of the things on our phone that we're constantly looking at, reading, video clips. We all live in a video digital age. And even if we weren't raised in it. So that's why we actually have created the program on student. Not only do we understand the modern student, we embrace the student. We have created this program so that it's able to progress through. And we do have review sheets because I'm sure everyone listening to this is research about how actually writing taking. But so we do have these digital sheets that they do print out and they fill in a certain amount. At the beginning, they're filling in a little bit. Towards the end, they're filling out the whole thing. It's just basically an outline based on the way we want the program and the actually applications. We have digital on screen. All of this is available 24 hours a day on their computer or mobile device. And their program, it's really all digital, all computerized. The foundational lessons are what we start with. So this is 30 days for the TMC. The CSE, we don't really send out as a video just because some of our methodologies are so proprietary that people are actually trying to steal them away from us a little bit. So we try to keep that one close. So here we have the foundational lessons. And in this section, it looks pretty much like the first semester or the first year of a respiratory program, depending on how your programs run. You know, it really is all of the foundational courses and lessons that they need in order to really understand the basics so that they can build and answer these questions with logic and critical thinking rather than memorization and guesswork. Because a lot of times that's what happens is they see something that reminds them of something else. And so they think that that's the right answer. Versus if they really, really have these foundations down pat, then they tend to do much better. So this is the first, 2 weeks or so. It's a little bit shy of that, of our lessons. And each day they go in and they do just one lesson. ABG review is the start because, why would you not start with ABGs? It's so foundational. And they're going to go through, they're going to read their little instructions, they're going to watch a video lesson, and then they are going to take a quiz. They're going to have a study guide that they should have printed out at the beginning. It'll have some information pre-printed on that. And we really like to do that, especially for like the drug review, things like that. We want to make sure they have the correct units of measurement that these drugs are in, things like that. We want to make sure that those are perfect so that they could recognize them easily in a test question. And then other things, of course, they would need to fill out. So this is how we start out. ABG, oxygenation, all the medications of respiratory, X-ray review, really understanding how to read that X-ray, what those different terms are. Hemodynamics. In here we have, in addition to EKG and hemodynamics, all of the cardiac drugs are in those 2 courses. PFTs, equipment. This is all of the equipment they would need, and then disinfection and math, of course, everyone's favorite. All right, the next 13 days is I think what this one is actually disease management. So in this section, they are actually learning how to break apart each of these diseases and really, really to understand them based on symptomology, based on signs, symptoms, and then also they're understanding how to treat each disease. Which diseases are going to need nothing but CPAP, and they're going to be a shunt. The oxygen's not going to help them. They're going to actually have to do CPAP. Which other diseases are they going to have to, choose something a little bit less aggressive? So we're going to talk about which oxygen devices to put on all of these, which treatment devices. Everything is going to be broken down in this section so that they understand disease management backwards and forwards. This is by far the greatest section of this course in numbers. We did a total disease focus, and we put all the information from the matrix into the diseases, so that therefore we talk about troubleshooting in the diseases. We talk about equipment and disinfectant, maybe a little bit more in the foundations, but everything from the matrix is included. We just have it in a much more student-friendly organization. The last section is all of the advanced concept lessons. Here you have initiating mechanical ventilation, adjusting, troubleshooting, additional ICU monitoring. So that's going to be everything from ICPs, hemodynamic, end tidal, TCOMs, chest tubes. So all of that will be in there. And then weaning strategies. And then there's a little section we have on education, home care, and rehab. And then we finish up with test taking skills. So we are really covering everything that is on the TMC, but we are just doing it in a way that the students can really embrace the process and it makes sense to them. Because if you think about this little journey we just took, we started with the foundations, we started with ABGs. I mean, we didn't go all the way back to anatomy, but we started with foundations like ABGs, PFTs, EKGs, and then we built on to all the diseases, all the different kinds of patients you're going to encounter on the exam. And in encountering those patients, what modalities is each patient going to need? What do you need to be aware of in that patient? Incorporating all of those foundations, what PFTs go with each patient. And then here at the end, we have all these advanced concept lessons. All right, the next video is going to be on actually jumping into the program, and we have case studies and other things that are in the program. So if you would like to join us for the next video, that would be great. And I am going to stop this one here.